what you're doing is not easy work, right? You're really trying to help someone overcome their challenges, overcome adversity. And while there's so much work, there's integrating that care of mental health, primary care, addiction, homelessness. Like, how do you integrate all that together to be such a game changer for your patients?
We have a great community of nonprofits and support, but at Bridgeway Center, we have the philosophy there's no wrong door, and the patient and the client is the most important thing.
Hmm.
So we are able to collaborate, and if a therapist is meeting with someone who needs some place to live, needs to get started on their benefits, we have those resources available to make sure that it is a whole person care, that it's not just treating substance use, not just treating mental health or primary care, that we are looking at all of those needs of that person and what it's going to take for them to be successful, because the opioid epidemic has just been horrific. It has changed so many families with the deaths of those experiencing the fentanyl overdoses. And so we're also in the prevention business, of course. And that is, again, where housing is so important, because without stable housing, it's very hard to get stable on your meds, to work a program of recovery, to go back to school, to have steady employment. So that's how we've gotten to the housing program. And we just make it our mission to solve those needs as much as we can. And with the support of our county commissioners, our city council members. And so we have a very good community that helps support our efforts.
What did you want to do before you kind of accidentally took a job that, was a career, right? Like, this is
Well,
truly purpose at a very early age. It wasn't about the paycheck for you, because I can imagine that as you started to get a car and all these different things, you realized like, wait, I could do other things, that make
well,
bring probably more money, but this was peaceful for you. Can you kind of talk about what were you going to do before you got to this space?
that's a great question. I grew up in Central Florida, Polk County, and back when I grew up, it was very rural, very agriculture,
Hmm.
and we did not have a lot of resources. So I started working very early at 14 years old, working at a local restaurant. It was called Champs, and we was flipping burgers on Friday night, Saturday night, and so I started very early working. But from that, then I started volunteering at a hospital as what we
Hmm.
used to call a candy striper back in the day. I had my little pinafore that I wore that was candy striper. And so, working, volunteering at the hospital, I wanted to be a nurse. I wanted to be an RN. That's what I thought
Okay.
that I would go on to be. But you can't be squeamish with blood, though, to be a nurse. And
Hmm.
so, but my calling, God had a different path for me at Bridgeway Center. So, but that's what I thought I would be doing, but it was not to be so.
You're not too far off then. You're still in the
No.
space as you mentioned. I'm just not dealing with the blood, and
Yeah.
I'm the same way. I'm very like don't want to see that. So my wife was she gave birth, and you know at some point I think they needed a doctor for me because I was sure going to pass out, especially when they dropped the placenta in that little bucket. I'm like,
Yeah.
oh. You had to get somebody for me, but it's even like that when I give blood. I don't look. I just do it. I don't want
Yeah.
to look at it. Oh man, I get nauseous. I get nauseous. Kudos to the people that do the work. It ain't me though.
Yes.
Um,
Yes.
40 years doing this, right? I
Yes.
can imagine you've seen so much change, some good, some bad when it comes to maybe the government, just technology in itself, where we at as humanity, right? There's so many different um, things that can affect where we at when it comes to what you're doing. But now one of the biggest things that everyone's talking about is really AI, How do you
Yes.
guys see AI after all these years? We have now this new technology that's really kind of helping us do more of the things that we love and maybe less of the things that are more repetitive in the admin and maybe able to even communicate better when it comes to our patients, whether that is physical communication or even just, emails or cell phones. What is your thoughts on AI in this space?
I think AI certainly has a place. It's here, it's not
Hmm.
going away. And so our challenge is to put up some guardrails.
Hmm.
AI is great for task replacement, it's great for doing a quality check on progress notes, treatment plans. It expedites a lot of writing, but it will never take the place of a therapist. They have tried to use AI and some chat bots in place of, the chatbot therapist will see you now.
Hmm.
I'm very concerned about that because it is critical that you have a therapist that can, whether it's in person or virtual, that can identify what's going on with that person. As important as what is being typed or spoke
Hmm.
about is the body language. The therapists are trained to read the body language, and if things go south, that therapist has to be able to call for help, do a welfare check.
Hmm.
And so I think that, again, there's a place for AI, compliance, quality, task replacement, but they cannot do therapy at this
Hmm.
point. I know that AI can identify, little cells in your body very quickly that other physicians may not be able to see right away, but therapy is so much different than that health. And psychiatry is something that when you're prescribing medications, you need to be able to get that feedback. And especially some of our clients that are severely and persistently mentally ill, that you can't substitute an AI bot for a psychiatrist to deal
Hmm.
with those that have some of the most complex and challenging issues. And with working with addiction also, we have to have guardrails on how we use AI in behavioral health,
Yeah.
certainly.